Welcome to Take Your Medicine podcast. I'm Phil Cowley, a pharmacist for 25 years. And during that 25 years, one thing I've learned is the more you listen to patients, the more wisdom you have. In fact, I liked it so much, I decided to start a podcast where we bring real people in who've taken their healthcare and empowered themselves. And from those individuals, we'll learn more than any clinician can ever teach you. Today, the beautiful, the wonderful star of the stage, big screen, littler screen, and now the tiny screens that are in everybody's hands.
Yeah.
Jillian Gottlieb is with me. She is absolutely in every way a doll, and you need to go follow her right now. Jillian Gottlieb, if you like skin, she loves skin. If you think you're good at skin, she's better at skin. She's
Yes.
amazing. Go see her on Instagram and TikTok, Jillian Gottlieb, and I am so thrilled today.
I'm so happy to be here. I am the biggest fan of you. After you found me, I found you, and I adore you.
You know what I love about this? You and I have, so everything I do is from a very budget standpoint.
I think we're the same person. It's like
Except-
budget, comedy, simple tips, no BS. We're very similar.
And we're doing it for education. And that's what I love because people who are really in for the education can
Yeah.
listen to one person and listen to another person and make their
Yeah.
own stew.
Yeah.
And there are so many people now who feel like they have to be either in the camp or out of the camp. And that's
Yeah.
all there is. That the
Yeah.
more fun, she's so fun. The more fun people you follow who take themselves serious enough to know that they're in charge, but not so serious enough that everybody else has to agree with them. Jillian is your person.
Oh, thank you so much. Thank you. I'm so excited to chat with you.
Most important thing you can be doing for your health later in life is obviously creatine and collagen. And here's the reason why. Lean muscle mass is the best indicator of how long we're going to live. The only problem you really have is finding a creatine and collagen that you trust. So sports research has been around forever. They're an industry leader that you can trust. And the best part is they have the strictest guidelines on what kind of product they'll use for both their creatine and their collagen. And of course, the best part is if you put in code PHIL20, you get an extra percentage off. So put in code PHIL20, save some money, and go right now to sportsresearch.com and get your creatine and your collagen so, well, you can have a better, longer life. Hair care was never really my biggest problem until it became. And now I found the difference between one product and another is huge. So what I listen to is you, my listeners and followers, what you like. Bonda Boost has never had a bad complaint given to me. I love the products that Bonda Boost have because people always love them. Don't you like a product you can just tell people to use and you know nothing's coming back to land on you? You know you can trust it. Bonda Boost, their HG product line, has been wonderful. That thick, full-looking hair that you've always been looking for. But the best part is your scalp, your head, your hair will all love it. It will feel the way you want to. So go to bondaboost.com right now. Use medicine 20, save a little bit money, and I don't have to worry about a thing because I know you're already going to love it. Okay, I want to start first with your history a little bit because for
Sure.
me, the teeny screen is the one I know. The idea
Yeah.
of getting on, so you were on stage for a long time, right? There in New
Yeah.
York.
I was a theater actor for many years, and then it just didn't make me happy anymore. And I'm a big believer in doing whatever makes you happy. And when it stopped making me happy, I decided to quit. Then I became a middle screen actor, so film and TV, and I still do that. That's my primary job, and I love it so much. And then a few years ago, I became a very small screen actor, Instagram and TikTok. That was very random how that happened. And I built a following pretty quickly once I leaned into just being myself. And now here we are. I think I started about 2.5 years ago, maybe seriously posting content and taking this serious as a career.
I think you and I started about the same time, and it's kind of funny. I've
Oh.
listened to some of your other stuff, and you were like me, like you downloaded TikTok, and you're like, okay, what the crud do I do now with it?
I had no idea.
Anybody who's not watching this on their phones, I got to tell you that she looks like she's like 22, like her skin is pristine, which tells us
Thank you.
something right now. It tells us that she takes it very seriously because it is a consistency that lets you keep your skin that way. Everybody's looking for
Yeah.
that silver bullet, that one cream, like I'll put this on and in 2 days it'll look like I'm new.
Ugh, No such thing. No such thing, people.
I am looking at hard work and dedication right
It
here.
is hard work. It is I call it my 5 and 5 routine. I do 5 products in the morning, 5 at night. They really never change unless I'm testing out a new product. I am a huge believer that skincare and having good skin does not have to be expensive. You do not have to spend a lot of money to have good skin. You just have to know what products actually work. You have to know how to use them and you have to be diligent with them. But there's so many people saying what they think on the internet. It's hard to find the people that you can really trust.
Yeah, and absolutely. And the other thing, all those people who are saying things were caught down to 15, 30, or 90 seconds to give you everything you need to
Yeah.
know. One thing I really do like is when people learn a lot and they're like, okay, is any of this true? And then they go look again. It's that
Yeah.
empowerment.
Yeah.
But I also love the fact that you're like crazy honest about everything you get done. So we live in a world where anybody
Yeah.
who's using Ozempic has to like pretend like they're not, which is insane to
Yes.
me.
It's crazy to me. That's crazy. There's nothing I don't like the shame that is around Ozempic, that's around Botox, fillers. My whole goal is to destigmatize these treatments because we have autonomy over our own bodies. So nobody should judge us except for ourselves if we feel so inclined, but I'm not ashamed of anything I've done. I'm proud of it. I want to share it with you. I've had a nose job. I want to tell you about that in case you're interested in having plastic surgery. I've had Botox, I've had fillers. If you're interested in that, ask me, let me help you. I don't hide anything. I don't see how that helps me. I don't see how that helps you.
Well, it doesn't help anybody. Most people that have shame, the problem you have is that they're kind of hurting on the inside already. And then they're
Absolutely.
hurting here, and then they feel like
Mhm.
they need to hide it, and then it becomes this whole cycle. And there is no such thing as a bad substance. I always say there's no good drug, there's no bad drug. It's
Yeah.
all tools. And when it comes to skincare, there's no bad tool in the skincare world. It just depends on who you are. So it's really
Yeah.
important that these are our experiences. We're not giving medical advice here. What we're doing is
Right.
we're telling you information. So you always want to talk to your doctor, your dermatologist, your healthcare
Absolutely.
provider. We're here to give you, I think people are smart. We give them information, they know what's right, and they can quit with the shame. Because if you don't like the way you look, you don't like who you are, and then
Yeah.
w you can say, "I don't really care," but we all care. We all
We
see those
all care.
bags underneath our eyes. We all see the
Yeah.
wrinkles we don't want, and we all see ourselves in the light we want to. But back to you. I wanna start at the very beginning, can we? So, you and I both took Accutane, which
Okay.
I'm a huge believer in Accutane.
Me
However,
too.
when you take any substance, whether it's Accutane or
Yeah.
tretinoin or whatever it is you take, there's always 2 sides. So you
Yeah.
have to pick up the whole package. You can't say, "I only want the one half." So my whole family's got cystic acne in it. So I listened to a lot of your stuff out there. Just so you know,
Oh,
when you were about
good.
13, I started about the same age as you did, but I went 6 cycles straight.
6 cycles. Oh god. Okay.
So
Well,
tell me your experience so everybody can hear it from you because
yeah,
we
so
had similar.
I'm pretty sure I was on 3 cycles. At a young age, I had horrible cystic acne. I mean, for anyone that doesn't know, those are those huge, painful pimples that don't have a head on them. It's kind of like underground volcanoes that come out. They're very painful, and they're even more painful when you're a teenager and you have to show your face at school. So I tried absolutely everything, and then I was put on Accutane, I believe, at the University of Pennsylvania. Like my family was really looking for what could help me. Accutane helped. I mean, it got rid of my acne. It did come back in my 20s, so now I'm on something called spironolactone, and I've been on it for about 7 years. But acne has been a huge part of my life, and if I stopped my pills right now, it would still be a huge part of my life, even at my age.
So we don't talk a lot of times they talk about Accutane, and it does come with a lot of side effects. It dries your
Yeah,
lips out to where
yeah.
you'll remember how dry your lips were for the rest of your life,
I will never forget.
right? Like, they
Oh
crack,
my god. I
you would
could
dare
feel it.
smile,
I think for 20 years my lips were dry. I swear to God, I think my lips just recovered from Accutane 20 years later.
which
Over
is why
20
we're gonna
years.
jump into fillers for lips for people that have been on Accutane because we ruin the collagen at a young age, but that's a whole 'nother
Absolutely.
side.
Yeah, yeah.
We'll get there for sure. I used to get cracks underneath my fingernails because I was washing dishes at a pizza place from the Accutane.
Oh,
That all being said,
yeah.
and the depression is real, that you can get with it. It is a real thing.
It was
I'm
real for
glad
me.
I did
Yeah.
it.
Yeah, that's great. Yeah, I really struggled. I mean, I was struggling with a lot of things at that age, but the Accutane did not help. I remember how awful I felt. And then I was put on a lot of pills when I was between 14 to 17, I think. Antidepressants, ADHD meds. I was put on so many things, I felt like I had a blanket on top of me. I think I was heavily over medicated. And I think that's one of the reasons as an adult I'm so serious with my health is because I remember the feeling of, I didn't know how to talk to doctors. I was a child and they just threw pills at me and I took them every day and I was like a zombie for years.
It's like you've listened to this before, because the whole thing on this is when you go into a physician's office and they
Yeah.
say, "Here, take your medicine." And the thing about a physician is, and I say this every episode on purpose, no doctor, no nurse, no pharmacist went into it because they didn't want to care. They went in there because they wanted to
Yes.
care, but
Yes, of course.
the system, like, squeezes you. So when you see a 14-year-old girl come in and she's got acne and it's for real, your 19th visit of the day, you forget to see it from their eyes sometimes.
Yeah.
But patients don't forget, and everything you learned from having acne young actually puts you in a position, I think, to meet Dr. Claire. Am I right?
100%. My Dr. Claire is my dermatologist. She is a gem. I got so lucky with her. I did not seek her out. She was just a recommendation to me from another dermatologist who was fine, but she was the recommendation as the cosmetic dermatologist I should see. And I didn't research her, which, I mean, you should always do your research, but I got very lucky meeting her. And the second I met her, the second we chatted, I think we spent 20 minutes talking. I knew she was the one and I'd never leave her. And I've been with her for years and years now.
So what's the difference, so everybody out there knows, between a cosmetic dermatologist and a
Yeah.
dermatologist?
So cosmetic is for cosmetics. They will do Botox, they will do fillers, they will do laser treatments. They're kind of, they're an artist, right? They're helping sculpt your face. Medical is everything medical. They're giving your skin checks. They're consulting for acne. They're looking at your moles and they're looking at everything. Dr. Claire is a medical and cosmetic dermatologist. And for somebody interested in cosmetic treatments, I do always recommend seeing a cosmetic and medical dermatologist, with which most of them or if you're cosmetic, you're also usually medical, which is wonderful. So, while they're giving you their Botox, they can look at that weird looking mole and say, maybe we should biopsy that as well. So,
Yeah, absolutely. And,
yeah,
it's an interesting time because, 10 years ago, aesthetics was not very common. Like, they were around, you
no,
couldn't find them. And now it's like
no.
you get really, really good ones. There's a lot of really good ones. And then you also get some that are basically doing it out of their garage. And so it's one of those things that when you talk aesthetics, you have to do some research. Now, I know you got lucky
Yeah,
finding Dr. Claire, but if
yes,
you were going to not be lucky or you were going out today to find somebody to do
yeah.
your Botox,
Hmm.
to do your, because fillers can go from looking, wow, how nice is that, to holy cow, she looks like a duck in like seconds.
Absolutely. Everything can go wrong in the wrong hands. I always say it's more important who's doing the treatment than what you're getting done, right? So the same exact 10 units of Botox with one injector can look one way, and the same units injected with somebody else's hands doing the treatment can look totally different. So I always say word of mouth is best. You have a friend that looks gorgeous, ask them who their doctor is, ask them who they go to. Write to me, write to people online. I get DMs every single day on Instagram from people that don't follow me yet or are new to my page. Hey, Jillian, you look great. Do you have a dermatologist? I'm in this area. And I happen to know a lot of people around the country that now I'm comfortable recommending people to. So ask. Don't be scared. I think the issue is that people are too scared to ask, especially when it's for something cosmetic, because there is that shame surrounding it. So people are curious about Botox or something like that, and they don't know who to talk to. They're too nervous to ask a friend.
There was a movie that Ricky Gervais was in with Jennifer Garner, and where he had to tell the truth on everything that he.
I remember that movie.
They went to a nursing home instead of being a nursing home. It was a sad place where old people die. Like, it had to be
Yeah,
the truth.
I
I always
remember
wonder
that.
how much better our lives would actually be, though, if we all came out and said, "Yeah, I got Botox, and I went to this person, and I ended up with the Rock's eyebrow, so I went to this person and fixed it." Like, it'd be so interesting if we
It
were
would
truly
be,
honest.
oh my God, it would be so helpful, right? If we all could just, and there's a lot of people that won't share their doctor, won't share who they go to. Please. It's not, sharing information doesn't hurt you. It doesn't take anything from you, right?
Right?
So
Nothing.
it takes nothing from you. So I think, we're not on this earth for very long. We might as well be honest and help the other people while we're here.
Right. And that's actually the last question. I'm going to warn you ahead of time.
Yeah.
So when I got onto social media, I didn't expect anything to happen because I was just this little pharmacist in a farm town
Yeah.
in Utah. When we finally started moving, I had somebody ask me a very serious question, said, "What do you want from this?" And
Mm,
I thought for a long time, and I decided if I could make the world 1% kinder, that would be the very best thing that can be. So at the last question, I'm warning you now, I'm going to ask you, how do we make the world 1% kinder? But what you're
mm.
talking about is already down that road, because what you're saying is you need to be honest and upfront, because just because you didn't like somebody, you can say, well, they went pretty heavy handed for me. I'd rather go a little bit lighter.
Yeah.
Or just watched your reel like 12 times with the Morpheus. Your sound on that should be
Oh,
like
yeah.
viral. Like
Oh,
it's,
yeah. Oh,
it's
I hated
so
it. I hated
funny
it.
because some people
Um,
love the Morpheus. It's the radio
yeah.
frequency injection. They love it.
I
You
I think
don't.
I'm always very clear to say, "Hey, this isn't for me. You might like it, wasn't for me." Even in, reviews I do of makeup or skincare products, I'm always beyond honest. I say, "I didn't like how this looked on my skin. You might love it, just wasn't for me. Thank you so much for sending it." I don't think enough people are honest. They all want people to like them on social media. I don't really have that care. I think if I'm just myself, you either like me or you don't. And if you don't, I mean, I'm here for you anyway. If you want me to help you with your skincare and you've been a troll in the past, I'll help you. It doesn't bother me.
Well, I've had people that seem like they're trolls, and I kind of have a little respect for some of them when they're being progressive with what they're saying, but I've had people disagree with me, and my
Yeah,
answer is, if you're out there and I'm out there, then people in the middle get to hear everything they want. I think we could
yeah,
get along just fine, even though we
absolutely.
disagree. I love that because one of your products, I wanted to jump into this because this is
Yeah,
one, as a
please.
pharmacist, you're using a 12% hydroquinone cream. Is that correct?
Yes, but I only use it usually 2 months out of the year.
So it's melasma season now, if I remember right, because it's usually
Uh-huh.
September is about the
Mhm.
time you go get. Now, I don't know the lasers as well, so you're gonna have to teach us. So melasma,
Yeah.
a melasma is something that a lot of women struggle with, and
Yes.
it can be signs of PCOS, it can be insulin resistance underneath. At a
Mhm.
cellular level, it is something as a pharmacist and as dermatologist, you start looking at like, okay, there's something going on with your hormone, there's something disrupting it, we're having
Yeah.
not enough estrogen or too much estrogen. But from a patient, they look at it and say, I have a brown mustache and I just
Yes.
want to get rid of it. Talk to us about your melasma experience. So I want to start before. Like, you're an actress,
Yeah,
your face is part of what you're
it is.
selling.
Yeah.
And let's talk melasma and what that did to you.
So other than acne, melasma has always been my biggest struggle. When I was around 26, I believe I was on a vacation with a girlfriend. We were laying by the pool. This was before I took care of my skin at all. And she said, "Hey, you've got dirt on your forehead." And I was like, "Oh, what?" And I started rubbing my forehead. And she was like, "No, the dirt is still there." This is how quick it happened. It was wild. I was laying outside all day in the hot sun. So I went back up to the room. And as the day continued, the spot turned into a big, dark brown circle. It happened so quickly. It was wild. And that was 11 years ago. And ever since, I have been struggling to get rid of the melasma that's all over my forehead, all over my cheeks. I will say it's pretty much gone now. And that's because of the regimen that I do, which is about 2 months a year. I use this 12% hydroquinone product, which my dermatologist likes. I don't use it any longer than that ever. It's from Muesli.
Usually,
Anything under that percent has not worked for me. I've also tried histamine. It didn't work that well for me. This works very well for me, but you never want to use hydroquinone for too long. You know this because it can cause something called ochronosis, which is the darkening of the skin, which is what we don't want. A lot of people are wary of hydroquinone. I totally get that. It's worked for me though. And then I'll do usually a yearly light laser treatment. And now the biggest thing for melasma, the biggest difference that I've made is that now that I take such good care of my skin with my morning and night routine and my skincare, I protect my skin. I wear a UPF hat. You will never see me outdoors without a UPF hat on and sunglasses, and you will always see me reapply my sunscreen when I'm outside every 2 hours.
say
It's
that
made
again. One more time. Tell them how often they have to do it because that's the key,
ev-
right?
every 2 hours when I am outside, especially if I'm laying by my pool Or if I'm outdoors, I will reapply every 2 hours without fail. And I only wear makeup when I absolutely have to. So I'd say I wear makeup maybe 3 times a month. So reapplication for me is usually the liquid, right? But for everyone that asks me that if they're wearing makeup outside, you can reapply with a spray, reapply with a powder, but wear a hat, especially if you're wearing makeup and you can't reapply with that liquid every 2 hours like I would love you to. Wear a hat, wear a UPF hat, please, a wide brim hat that fully covers, not a baseball hat. It is so important.
Hey, there's so much there that is all right. So I want to make sure we don't miss any of them. First,
Okay.
I want to
I
go
can,
into makeup real quick because
yeah.
so I'm terrible about sunscreen, but I'm also an ugly old man and I don't have to do that because pharmacist
You're a
levels are not.
gorgeous man.
It's just because I'm a pharmacist. So the level was already set low. See, if I was
Right,
a male
right.
model, I would be
You're a
like,
gorgeous
there
pharmacist,
we go.
for
But that
sure.
that's easy. You just have to pick
Yeah,
your niche on
that's
everything.
true.
I'm
That's
not
true.
going
Yeah,
into
there you go.
modeling. I'd
There
be
you
like a
go.
3. I met with a guy that was on Bachelor in Paradise, and he was telling me about how once they get into Bachelor in Paradise, the problem is everybody's used to being a 10.
Yeah.
But once
No,
they're all
no more.
10,
Yeah.
somebody has to be the 2, and he goes, it freaks
100%.
him out.
That's so
So
funny.
one thing about it is I love your take on makeup, and here's why. There's this cycle. I've seen my wife do it. I've seen everybody do it. You have really inflamed skin.
Yeah,
Um, Inflammation is really like I'm really big into the gut skin axis and the fact that the skin
absolutely.
will make the gut worse and the gut will make the skin worse. And now it's the
Absolutely.
gut skin brain axis. And the dermatologist will say, yeah, if like it's all tied together. So a lot of times they'll be really inflamed. They'll have lots of rosacea, they'll have all these problems. And so they want to go out. They don't like the way that they look
Yeah.
and they put on these makeups. But a lot of the makeups, in my
Yeah,
opinion, have disrupting things in them. If you're wearing them all the time, you
I
could
agree.
easily expect that skin to get worse instead of better.
Absolutely. I mean, I totally understand when you're not happy with your skin wanting to cover it, but I am telling anybody listening, if you are struggling with your skin, please only wear makeup when you absolutely have to. If you're just going to the grocery store, do your normal skincare routine. Wear a beautiful tinted sunscreen. There's so many gorgeous tinted sunscreens that look beautiful. Do an eyebrow pencil if you have to. Leave your face alone. If you want your skin to get better, stop covering it up with these pore cloggers that are just going to make it angry at the end of the day. And if you have to wear makeup, there's a lot of good makeup now that has a lot of skin benefits in them. So it's not just, makeup. You're getting niacinamide, you're getting some brightening agents in the makeup. Okay, those are usually like BB creams and things, but I would encourage anyone struggling with their skin to try to tone back on the makeup if you can, and if you're comfortable with that.
See, that's important because we want everybody to feel
Yeah,
engaged
if you're not comfortable with it, that's okay. There are some great foundations that have a lot of skin benefits again, and anyone can message me at any time and I'll tell them what they are.
so I always love the ones where you start reading in it, it's got essential fatty acids right at the beginning, the jojoba oil. Like if they
Mhm.
start with those things, if you start with
Mhm.
something you can't pronounce is the first thing you've got. I always get say,
No,
be
you don't
real
want that.
leery if you can't say it, like if you don't
Yeah.
know it.
Uh-huh, and that's something that I've talked about a lot with my cosmetic chemist friends who I do a lot of videos with and my dermatologist. You're looking for those first couple ingredients. Those are the really important ones.
They list them usually by how much they put in there, so it's kind of one of those
Exactly. Yep.
interesting things.
Mhm.
If you get down to about 6, you're now talking a very trace amount of things.
My dermatologist always says you want to really look at the top 5.
Yeah, the rest of them could be in there, but when there's 35 or 50 ingredients in there by the end of it. Okay, now there's another one I wanna jump into because there's this thing about witch hazel, and
Yeah,
your skin is gorgeous. I do have one
thank
question
you.
about your hydroquinone, though. Are you ready?
Yeah, tell me.
Your eyes aren't raccooned. So most
My
people use
I
the aren't raccoon. Most people who
Mhm.
use the hydroquinone, they put it on their face. They can't get close to their eyes, and so their eyes end up having pigment, and the rest of them doesn't. How do you make it so your skin tone is even?
So with the muesli, I'm not really sure about I know there's like hydroquinone pads and everything. Mine is just like a spot cream, and you're only meant to massage it into the melasma, not to the whole face. And I don't have melasma near my eyes.
That's
Like
perfect.
my
That's what I wanted to hear because people like to take that and they like to put it on all their face so they get a bright
No, so
face.
so you're putting hydroquinone everywhere. You're going to brighten the areas that you don't need to. We're trying to help the melasma. We're not trying to fix everything else. It's a spot cream, right?
Yeah.
So unlike retinoid, which will go everywhere, or your other things, You just want to massage it into the melasma. We're not trying to lighten the other areas. We don't want to get a uneven face.
So perfect. I knew you'd know. That's why I wanted to ask you. I knew you did because people do that all the time. You see them. I actually can watch them walk down the street. And I'm like, oh no, nobody told them. And they brightened everything, but right around their eyes, and so it looks
Yeah.
like they're wearing a mask. And
It,
so you don't need to
yeah.
be afraid of it. You can use it short term, and it does help.
Absolutely. Short term is key. It does help. And again, I think where people really run into trouble with hydroquinone, with retinoid, is not knowing how to use it and then using it every day, never stopping, not knowing how much to apply. Please ask me. I'm right here. Let me help you. Like, nothing makes me happier than helping people with their skincare. Let me guide you.
You want to go to Instagram, Jillian Gottlieb. You want to do it now. I'll make sure that it's spelled out because if you're from Utah, it's hard to spell her last name. So I had to like
Yes,
practice saying
absolutely.
it. I hope I've
Yeah.
said it right so far.
You've said
So
it right. It's Jewish. It's like it's just, you say it just how it sounds, but it is tricky. It is tricky for a lot
well,
of
you
people.
know, but you wanna go see it right now. Okay, so we've gone through a couple of things. So this is
Yeah.
all about journeys. So we started out and you had your acne journey.
Hmm.
Now, you mentioned you got rid of it and it came
Yeah.
back, and you started
Yes,
taking spironolactone, which
I did.
helps you process your progesterone. So it's the progesterone wants to go one way or the other, and with the spironolactone, which is an extremely inexpensive medication,
Yeah. I'm curious for your thoughts on spironolactone.
I like it. It's just more for me is that we originally found it to help with water. We use it to help somebody who's got a lot of fluid retention.
Right.
And it's got this secondary effect. So it's actually it, like, echoes my whole thought processes, which is you can't take a medicine without having multiple effects. If I have somebody who's got hormone disruption already or has issues, and then I'm trying to get rid of their water weight, if I put them on spironolactone, I just mess with their
Right.
hormones too.
Absolutely.
And then the other thing is that I've already watched you take like 7, 10 drinks of water since we've been on here. You already know, no matter what you do on the outside of your skin, if you're not hydrated, it's nothing.
It is nothing. You know how much water I drink, Phil? I am nonstop. I don't drink alcohol. And that's not like a skin thing. I don't drink soda. I drink one coffee a day and I chug water nonstop. I love water, lemon water. I love water. And yeah, I mean, listen, I'm 37. Like I eat not that well, but I drink very well.
You don't look anywhere near it. And the way to tell if whether you're drinking enough water is when was the last time you had to go pee? Because if you haven't had to go pee for a while, then you're not
Yep.
drinking enough water
A
because
100%. And is this true? Someone once told me if you're thirsty, you're already dehydrated.
always,
Yeah.
because it doesn't even trigger until it's way down the road. So it's
All
always
right.
that
Well,
like,
I'm never thirsty. My partner, on the other hand, he's always like, I need a drink. And I'm like, then that means it's too late for you, bud.
well, and your partner, he's going to be like me. Like I don't drink. And then all of a sudden I'll put down like seriously half a gallon of water and then I'll pee it all out. None of it gets
Yeah.
absorbed because I've overdone it because I haven't been, like,
Yeah.
I know what I do wrong. It's just
Totally. We all
men get
do.
away with a lot more than women. At least they have for a long time.
No, they do. Oh, of
We get
course you
away
do.
with
You're so
so much
lucky.
more, but women live longer, so we men think, "Oh, we get away with it."
Yeah.
We don't get away with it, we just die earlier, and we're just like, "Okay with it, I guess."
Yeah. You have to be.
So we've gone through now with your acne, when it returned, did the
Yeah.
spironolactone take care of it by itself? Because I know you're using, retinoic acid at night
It
as
did.
well.
So it's interesting. So I think I first went to Dr. Claire, my dermatologist, in 18, 9, 21, 2, 3. I'm doing math. When I was about 30-ish. And I went for my under eye issue. I had some under eyes going on and I got filler. And then the second issue was melasma. And then the third issue was the insane cystic acne that started popping up again in my late 20s. So I had about 10 years free of acne. And then it came back, which my doctor explained can happen. Even though Accutane is a cure, it can come back. So she put me on spironolactone, and I'm on a very low dose. I'm on 25 milligrams a day. I take it at night. I've been on it since I met her. So that's 7 years. I don't have any. A lot of people ask me about my side effects. I don't have any that I can tell. I mean, I don't have to pee more often than like normally. My weight has always been the same. So for me, my acne's just gone. And in those 7 years, I did try twice to stop it just because I'm of the belief if I don't need to be on something, why am I on it?
Mhm.
And those 2 times that I stopped it, I got the worst cysts of my life within the next couple weeks. My whole lower face broke out into an insane amount. And Dr. Claire said, it's not hurting you. There's no side effects. You're on 25 milligrams. go back on it. I know you think you're too old to still be on acne medication, but go back on it. And I went back on and immediately my skin cleared up. So for me, it has been a game changer. Again, I can't speak to anybody else. I'm not a doctor, but for me, this has really helped me tremendously.
Yeah, and a lot of people will use the spearmint teas, and you can get there, but you have to drink a lot of spearmint tea to get there, but a lot of people like that.
Yeah. Uh-huh.
You can
Uh-huh.
get there, but it's hard. Most people that are selling the spearmint teas, you've gotta go so much because it's all about potency.
Yeah, it's spironolactone. I think the one concern everybody writes to me about is they're scared of these side effects, which I've never had. I just haven't had any, so I can't.
You're so hydrated and you're doing all those things right.
Yeah, maybe that's it.
So PCOS is now gone up by 50% in the last
Mm,
10 years. And there's a lot
wild.
of side effects people are seeing with PCOS, including cystic type acne, and
Mm,
that there's all these insulin resistant.
mhm.
As a patient, just generally speaking, is this something you worry about with what's inside of cosmetics? Like, are you worried that maybe what we're putting on or what we're eating?
I do worry. I worry to an extent. I know that from having so many, and if you follow me, I do a ton of videos with my friends who are cosmetic chemists and scientists. I've learned so much from them. And they explain to everyone that the products that we're putting on our skin have gone through such rigorous testing, especially things like retinoid, things that are a prescription, things that, the toxicologists test all of these products. I don't worry in the way that other people do. I think I get 10 to 20 messages a day saying, "Hey, Jillian, are you worried about this ingredient in Vana cream? I Googled it and it says that it causes cancer." People don't understand, I think, that one ingredient, we're not slathering on 1,000 pounds of this one ingredient. What matters is how all the ingredients work together in a formula. And I trust that these formulas have been tested and are safe for use. So I personally don't worry.
That's kind of where I was leaning in. So there's a lot of things. So aspartame is my favorite. So NutraSweet.
Uh
They
huh.
the first time. Now I know that there's questions. They're like, oh, we're finding it, and people are worried. But the very first study that showed that it had carcinogenic effects was when they fed rats almost a pound a day of aspartame.
And there you go.
So
It's the same with certain ingredients. People are Googling saying, this ingredient has been shown to cause cancer. And I'll look at the study and it shows in a rat where they only fed that rat this one ingredient for a year and then he got cancer. So
that's
you have
exactly
to,
where do your research. So, what I really love about Jillian is you know that she's read it. See, she's so well spoken, and I'm hoping she'll sing to me for me one time on that piano behind her because you know she plays it. She's talented, but she's brilliant because she does her research on the silly videos that we both do. People don't understand the time and effort you put in
yeah.
behind them, and I know that
Oof,
about you is that you've studied these things, and I think that's a really important message to put out when you have a reputable brand that has done the third party testing,
yeah.
then you know that there is a scientist out there who squirms in their skin every time they hear that this is not safe because that was their whole life for a year making sure it was safe.
Absolutely. And not only that, I mean, I have been lucky enough to visit some big labs of skincare. I went and visited actually L'Oreal's lab a couple weeks ago, this huge, amazing lab where 600 scientists work at. And I posted a video on it, and everyone was saying, oh, but they test on animals and it's horrible. And no, they don't. They've actually developed, this brand has developed something called Episkin, which is fake skin, which is
Right?
what they have always tested their products on. So there's a lot of people that simply don't do the research. And I'm happy to do it for you. If you're willing to listen, I will tell you. But there's just so much misinformation. It is so difficult. And I'm always very honest that if I don't know enough to talk on a topic, that is when you see my dermatologist sitting next to me, or you see a cosmetic scientist sitting next to me, or a cosmetic chemist, or my plastic surgeon. I'd say 40% of my videos have an expert sitting next to me because I am not about to add to the misinformation on the internet.
No, and it's so important that people understand that one chunk of information which somebody says, oh, that's misinformation, you need to take all of it in and start doing the research because there are things that people say are misinformation that aren't, and there are some things that they say are
Yeah.
information. People are smart. I think that they can totally get there. Now, there's two things I want to still do. First of all, there's a lot of people out there who going to a dermatologist is a once a year kind of like they can't do
Mm.
it. So I want to know what your if I had to do one thing, what my must on per whether it's fillers or Botox or what
Right.
would
So
be
it depends on what your goals are aesthetically, if you have those goals, and it depends on your budget. So it depends on those two things. But my number one advice always is to find a provider that you trust, because whatever they have in their office, they will have something that will work for you. So, for instance, if you're interested in a laser treatment to build collagen, don't start researching the laser. Find the provider first. Find somebody that you love, you trust, and they will probably have 1 to 3 lasers that will work for you. Really, it's really a budget thing. I think fillers are a last thing. That's, to build volume. Botox is great, especially if your wrinkles are set in or almost set in, to attack them if you don't want those lines at rest. But I really am a big fan of things that build collagen. I love a yearly laser treatment if you have that in the budget. I think a good, diligent morning and night skincare routine and a once a year laser treatment will take you so far.
okay, and now your morning and night, your 5 of E, they can
Hmm.
find that on Instagram. They
Yes,
need to
it's
go
my
listen
pinned
to it.
video right there. Yeah.
We would do it today, but I'm running out of time because I love it, the way that she structured it. So go to the pinned video and watch it through, write it down, and then implement it because you have to
Yeah.
everybody's skin's different, but it is so good. You gotta go look at it. It's fantastic.
Thank you.
Now, there's a never list. There's things that I'll never do again. Now, there's things
Mm,
that I would never do. Like, I gotta be honest with you, some of the stuff my wife's had done, I look at it and think I would never do that. It doesn't mean it's not good
interesting.
for somebody else, but what's a never for you again? Just for
Well,
you, nobody
okay,
else.
a never for me. There are two things: RF, radio frequency microneedling. That's the video where I'm screaming in pain. I absolutely hated it. I had grid marks on my face. It's not for me. My skin doesn't like it. And the second on my never list, I once had a marionette line filler. Oh, for me, that's a no. It was so painful. And my chin every night around 9, I swear it was like radioactive. Every night at 9 p.m., my chin started to feel hot. I had an anxiety attack every night for 3 months. I'm not kidding. The text that my poor dermatologist got of me thinking I needed to go to the hospital, I was like, I have an occlusion. I didn't have an occlusion 3 months later.
Right,
That doesn't happen. But
right.
I was like, I'm occlusing right now. Like, I must go to the hospital. Those two things I will never, ever do again.
So those are always I like to put them out there because everybody's different. So somebody else may have loved all those things.
Absolutely. And more power to you. You can have the extra filler and the extra microneedling that I am not having.
So I wanna thank you again. Now, she's on the big screen on movies like The Bros. She's got right now, you are working on what, right? What can we see you in right now?
I just finished a movie. I'm not sure where it's going to be out, but I will definitely. I mean, you'll see me post about it on social media. So I just finished that, and we'll see what's next acting wise. I'm enjoying my little break right now.
It's fantastic. You're gonna go find her on Instagram. Jillian Gottlieb is you're gonna go find her. Now, the last question I always ask
Yes.
everybody is if you could make the world just 1% kinder, what advice would you give to everybody? Because I always tell everybody when you're done with this, go give somebody a hug, send somebody a text that needs it, smile at somebody. So, what would you give advice on how we make the world 1%
I
kinder?
think we should stop judging other people for what they choose to do to their own body. I think the shaming on social media is out of control. And if you could, instead of saying, ew, you look horrible, you could say, that's not for me, but I appreciate you sharing that. Or not say anything at all and
Yeah,
just sign off for the day. I think if we could just be a little more tolerant to people that don't have the same views as us, we would be doing great.
don't start nothing, don't be nothing. I think it's the best advice ever.
Absolutely, 100%. We're not here for very long. So let's just be nice.
Absolutely. All right. This has been Take Your Medicine podcast. We've had Jillian Gottlieb on. It has been a wonderful time. I'm coming to New York and we're going to go run that loop. I will
I
get a
can't
hold
wait.
of you. So I just want to tell you before we end up, it's been really an honor. You are amazing. And I appreciate you taking this time so much.
Thank you so much. This was lovely. I had so much fun. Thank
Okay.
you.